I'm Dana with RMI. I'm excited to have you here with me today, and I'm very excited to talk to you on our consult here in a bit. So part of the conversation we're going to discuss today is going over the key concepts at RMI and what we offer. Be prepared to grab a pen and paper, take some notes, and please write down all your questions because I'm going to be happy to answer them and go into all the details with you so that you're well informed when we speak. So RMI at its core is a longevity center. We focus on how we can improve people's quality of life. We offer different treatments around that aspect, but at our core, we are a longevity clinic. The reason for that is because one of our founders, Dr. Vincent Giampapa, has been doing decades and decades of research on cellular aging and what really happens at the root level as we get older. Why do some people accelerate in age and others don't? Based on this research and all the data he's put together, we also identified something that took place in 2014 called the 9 Hallmarks of Aging. Basically what happened here is a group of scientists got in a room together and they sat down and they determined that there are 9 different things that happen within our bodies as we age. We then built our programs to address all 9 of those hallmarks so that you can age and have gracefulness and longevity for years and years to come. One of the most important factors and a 9 hallmark of aging is called stem cell exhaustion. What does that mean? So stem cell exhaustion occurs because as a human being, you are only born with a set number of stem cells. As we live our lives, as we participate in sports or trauma or anything that occurs to us in life, cause us to use up our stem cells quicker than other things do. And if you think of your body like a Ferrari, right? A finely tuned machine. You drive that car off the lot and you put the pedal to the metal, you're gonna run out of gas in about 120 miles. You drive a little slower in the slow lane, you're gonna get to maybe 200 miles. Our bodies are the same way. The further we push them, the quicker we use our gas or our stem cells. So it is very important to have your stem cells collected, stored, and then given back to you. Let me give you a little bit of insight on how we do this. Nobody else does this. This is something that, because of the research and the knowledge that we've acquired, we've really become very good at doing and addressing in terms of slowing down and reversing the aging process. So this is how it works. You take 5 days of senolytics. Senolytics are just oral compounds, and what those are going to do is kill the bad zombie cells in your body. Zombie cells are also called senescent cells, if that's something you're familiar with. They're bad. You don't want them floating around. So we're going to get rid of those prior to the collection. 3 days following your 5-day of oral compounds, you will do a series of Neupogen injections. These injections are very small, little bitty needles, like an insulin needle almost, that you'll administer yourself in 3 different places on 3 different days. What this does is it releases the newly formed healthy stem cells from your bone marrow. When they are released into your bloodstream, they divide into what's called a mother and a daughter cell. We collect the daughter cell. The mother cell goes back to the bone marrow and burrows there and waits to be called up, therefore not depleting you of your already diminishing number of cells, right? We don't want to do that. So we're not depleting you. We've just figured out the secret sauce in collecting the daughter cell so we can store that and give it back. Another point to mention, we collect 3 different types of stem cells: hematopoietic, endothelial, and mesenchymal stem cells. That's your musculoskeletal, your immune function, and your vascular system. All 3 are equally important as we age. We don't want one system out-aging the other. We want to address all the systems, so we collect all 3 types. During your collection, you will be in a chair, super comfortable. There's a TV you can watch, and you will have an IV in each arm. This process is called apheresis. What happens during this process is the blood and stem cells are pulled out, the stem cells are separated into a bag, and the blood is put back into your body. From there, they go to our lab where they are processed, put under the flow cytometer and analyzed, and then separated out in vials so that you can come back into your hundreds and have your stem cells given back to you every single year. So think of it this way. On a car and you have a fuel tank, eventually that dial goes to empty. We want to slow that dial down and keep it more level versus dropping to empty. That is what a stem cell collection does for longevity. In addition to the stem cell collection, we also do an umbilical stem cell infusion. It is important to understand that these two treatments perform different functions. If you think of a puzzle, these are different pieces of the puzzle. One doesn't out-trump the other. They're both equally important. The umbilical stem cell infusion does a couple of different things. Number one, it addresses the systemic inflammation in your body very well. They're like magnets, these umbilical cord cells, to inflammation, and they're attracted to that anywhere in your body that you have it, and they start bringing down that inflammation immediately. Because inflammation is the root of all evil. It shows up differently in different people and has different symptoms, but at the end of the day, it's all inflammation. So we want to address that. We want to bring that down. The other really cool thing, and I love this about umbilical cells, is the mitochondria in them communicates with the mitochondria in your cells. So when a young umbilical cell comes into contact with one of your cells, it influences your cell to act like a younger version of itself, thereby giving you more energy, focus, better sleep. Different people have improved eyesight. Different things happen to different people, but that's why that's occurring, because now your cells are functioning like they did years previously. So those stay in your system for about 8 months, okay? We get the umbilical cells from women who have C-sections. They are donated to us in our lab, and they are then processed. Our lab is ISO 7 certified. It is ran by 5 of the top microbiologists in the world, combined experience of over 30+ years. These guys are the cell whisperers, the Tom Bradys, whatever you want to call them, of what they do. When they process the umbilical cord cells, they're testing for everything under the sun. They're testing for different diseases, they're testing for bacteria, for fungus, and you will actually get a batch certificate that tells you these were negative for all the different tests we ran. It takes about a month from the time we receive an umbilical cord to the time they're actually ready to be administered to the patient. So you can be rest assured that all of these cells are of the highest quality. They're also analyzed under the flow cytometer, and they are counted so we know exactly how many we're giving you. We know the exact viability, meaning liveliness, and we know the exact efficacy of these cells. And that is a big differentiator in what we do and how we do it. You'll be able to visit the lab when you're here and actually meet everybody in person, take a tour, and ask any questions you have. Something else important to note, our clinic is licensed through the Minister of Health in Costa Rica. It took us 7 years to get that license. What does that mean? That means we are held to a higher standard. We are government sanctioned and we are held to a higher standard, and we hold ourselves accountable to that higher standard. Back to some of the treatments we offer. We also do something called plasmapheresis. Plasmapheresis is really cool, actually. So it's actually FDA approved in the United States, but it's hard to get, and you have to have certain kind of illnesses and things taking place, and insurance carriers are really difficult at approving them. But we use it here for longevity. And everybody, whether you're dealing with an ailment or you're healthy and you want to remain healthy, can benefit from plasmapheresis. This is why. So think of your body as a fish tank, okay? If you didn't clean out a fish tank for 6 months and you went to go check on those fish, they wouldn't be doing so hot. They'd probably be floating near the bottom. And the reason for that is because their environment would not be pristine, right? They can't function in a non-pristine, non-optimal environment. Plasma makes up 2/3 of your blood. It's that clear yellowish liquid, okay? So all day long, you have this dirty plasma that circulates through your body. In our plasma is where we collect toxins, drugs and alcohol, inflammatory particles, as well as viral particles, COVID, any other kind of virus. Those all live in our plasma. And what our liver can't process out stays there and continues to wreak havoc and create symptoms that are very difficult to address, and that Western medicine addresses with pills and pharmaceuticals. We're going to the root. Everything we do at RMI addresses the root cause. This is not symptom-based medicine. We are going to the cellular level to address the root. Not only do we do plasmapheresis, stem cell collection, and infusions, which are all three, remember what I said earlier, different puzzle pieces of the longevity puzzle you're putting together. We also offer different things that address quality of life in terms of function and mobility. So orthopedics, cognition, sexual enhancement even, right? Different people have different things that they experience in life that affect their quality of life. And it's our goal and our passion to address whatever it is affecting your quality of life and help you get better so that way you can live for decades and decades to come, enjoying the things you love to do with the people you love to do them. Our orthopedic treatments are unlike anything I've ever seen. And I've been in healthcare for the last 15 years and worked for some of the top spine, ortho, hospitals, and surgery centers. The approach we take at RMI, we actually utilize high definition ultrasounded guidance to look at every single structure you're having an issue with, or pain or tightness, and we treat the whole structure. We don't just shoot one or two areas, we actually look at the muscles, the ligaments, the tendons, and the joint. And we identify the root cause of where that pain is coming from. If there is degeneration in a specific area, the umbilical cells we utilize and inject in that area can actually turn into 220 different types of tissue. What does this mean? This means that they have the potential to regrow a torn rotator cuff, our cartilage in the knee. The damaged tissue releases signals that tell those umbilical cords what to turn into and what to regenerate. So we can do the whole body, any area of your body where you have pain, and we can inject it directly with the umbilical cells. And if you pair it with an infusion, you really get a 1-2 punch. It's the best way to go if you're trying to address inflammation both systemically and directly in your joints. One of the other treatments we offer is the stem cell facial. Men and women love the stem cell facial. This is why. So this procedure is done under a little bit of propofol, and it's done with microneedling and radiofrequency. After the microneedling and radiofrequency, we use the umbilical stem cells to help regenerate the collagen. The microneedling creates microtraumas in the skin so that when we place the 100 little injections of umbilical cells in your face, they stick there. And then, like I was mentioning before, they can start regenerating the collagen in our skin. So our skin looks more elastic, it looks smoother, the texture's better, and it just gives you an overall fresh, clean feeling. So that is definitely something that our patients are loving at the current moment. One of the most exciting new therapies we offer is for sexual wellness. We call this treatment Regenesis Enhance. We have worked with some of the top urologists in Houston and across the United States and even in Costa Rica to develop a protocol that has the best results and most minimal downtime. It is great for erectile dysfunction, moderate to mild, and we're also starting to treat some Peyronie's disease with it as well. I can get into this a little bit more on our consult if you have questions about this, but understand that there is a protocol in place where we administer stem cells through an IV, we utilize shockwave therapy, and we also do direct injections into the regions, and then follow that up with some hyperbaric chamber sessions. So again, if you have questions specifically about this, I'm happy to answer those. Some of the other treatments we offer are around cognition, immune function, and hormones even. We have a functional medicine specialist on staff who you will get to meet if you come to Costa Rica, as well as 8 amazing other physicians. What's a little different about us than anywhere else in the world is it's important to us to come from a holistic place and address all the different things that are taking place in your body that could cause your body to age at an accelerated rate. Remember, we want to slow down that process. So in order to do that, it's not a one pill fixes everything. You have to address each individual item. And whatever that is for you, we're here to help do that. And the most exciting part about what we do is we gather objective data on you that tells us your story so we can then take that information and create a personalized treatment plan. Our physicians are skilled at interpreting these different test results, and they will go over them with you at the different markers we have baseline, 6 month, and 12 month. So we can see the full picture of where you were before you started at 6 months after treatment, and then again at 12 months after treatment. So you have a little bit of an understanding what to expect when you get here. Our clinic is actually attached to a hotel, the AC Marriott. We also have a hotel about 4 minutes away, the Intercontinental, that offer 2 different types of options. One, no pool, but it's super convenient, it's beautiful, it's right in the heart of Escazú where our clinic is. You go downstairs to the lobby and our clinic is around the corner. The other one is more of a resort style feel, has a spa, a pool, a bunch of different restaurants. So it's just really what kind of experience you want and where you want to stay, and our logistics and patient director will help you decide where to stay upon that phase. Treatments usually last anywhere between 2 to 5 days, depending on how many you get. If you're just getting one treatment, it may be as short as 1 day. However, if you start incorporating multiple treatments or you do one of our programs, which we definitely recommend to optimize the body, then that starts turning into 3, 4, sometimes 5 days. Not always, but those are certainly things I can help you with and answer your questions on so you have a better understanding of how long you'll need to be in Costa Rica when you plan your travel here. Every single person is dedicated to your quality of health and to your goals, and we want to make sure you have the best experience while you're here. We look forward to meeting you. I look forward to introducing you to what will surely become your family. And I'm here if you need anything. Please feel free to reach out. Talk to you soon.